Hello everybody, this is Dr. Marc DuPéré, plastic surgeon at the Visage Clinic here in Toronto, Canada. I want to talk to you today about eyelid surgery. And no, you will not get a Picasso result here in Toronto. But if you want to come a little bit closer, I'm going to show you what we remove in an eyelid surgery. And you can see that my result is a little bit more symmetrical than Picasso, but less expensive. So I want to show you here what I've done on the lady today. I was able to remove a large amount, 13 millimeter in height in the eyelid surgery. I did a slight asymmetry in the excision because her left lid had more skin than the right lid. So it's important for us plastic surgeon to always look at the asymmetries before the surgery. But you can see I was able to remove a nice crescent of skin. The incision is right in her own crease. So for most Caucasian female, the incision is at 9 millimeter above the eyelash. And then we remove a crescent of skin. It's all measured with caliper very, very precisely. Now, I want to show you here the little fat pads. So the upper lid always has two fat pads. We have one in the middle and one in the inner corner. The one in the middle, I remove in many patients, not all the time. And when we do, it has to be conservative to not hollow the upper lid. When we remove too much, and we used to do that 25, 30 years ago, excising all the fat, it gives a bit of a deformity or hollowed eye, which we also see normally with aging. So we have to be a little bit conservative. But the inner one, I like to remove most of it. So you can see this lady had big fat pad in the inner corner of the eye. If you look around at home or at work today, you'll see lots of people in their 40s, 50s, and 60s will have this puffiness right in the inner corner, which is a sign of aging. That's fat that's herniating out. So we like to remove it for a nice crisp eyelid surgery result. This little corner here, I will try to explain because it's kind of nice. This is something I've learned with Dr. Bruce Connell in California when I did my fellowship many years ago. When we remove an ellipse of skin above the eye being here, this line here is longer than this line here. We tend to have some puffiness where the big fat pad is. If I remove too much skin here along this pattern, I will raise the corner of the eye, no good. So what I've learned with Dr. Connell is to remove a triangle of skin here, and then when I close, it will shorten this longer line so that now this line and this line are more of the same, and it helps the incision, helps the closure, helps to get a nice, beautiful, even incision. So upper eyelid surgery is a very common procedure both for men and women in Toronto. It has a lot of benefits for such a small procedure. It's an incision that's well hidden in the crease. For guys, it's 6 millimeter. For women, it's 9 millimeter. It heals very quickly. The thinner the skin is, the better the scar. So that's why it's also very common in male. People receiving this procedure will look better, younger, and restier. It's done often under local anesthesia with a tiny little twilight sedation for comfort. Takes about an hour to do in my hands. Recovery will vary a bit between 1 and 2 weeks depending on the swelling, and occasionally a small bruise. More common in male, so it's important if you are on a blood pressure medication to continue on your blood pressure medication to minimize risks of bruising. Thank you for watching. This is Dr. DuPéré in Toronto.